Hey everybody, good morning and welcome to Therapeutic Exercise. As I promised, I wanted to go through a screencast with you so that we don't get behind. I thought this material lended itself well to being out of class because honestly there's not a lot of discussion to be had, particularly with isokinetics. So this is just kind of content you'll need to know. This is always fair game for the BOC, I think decreasingly so over the years, but it's still considered content that you are responsible for. So even though we don't use isokinetics much at all in any of our clinical sites, the concepts are still important. It's still a good thing for you to understand the background behind it and kind of how or why it could be implemented if you wanted it to. And then with aquatics, obviously we're not going to be able to do pool work in class. I am still working on a lab day where we can go do some aquatics or see them done, but still trying to finalize details on that. So in the meantime, we will kind of break this out into two different screencasts. So the first one we're going to cover in this particular video is specifically on aquatics. So let's get started. All right, so in terms of what we're going to cover in this particular video, we're going to look at some of the terms that are important to aquatic therapy, some strategies that are used for rehab's sake that are good for you to understand. We'll take a look at why water is such a good therapy for particularly our early phase rehab. And then several methods and techniques that we can use, some of the equipment that would be important for you to have or have access to, and then some examples of some upper and lower extremity exercises that you could incorporate. Now I will tell you, I used zero pool therapy before I started my graduate assistantship. So in my undergrad, we had an Olympic-sized pool, and it was a good space, but it wasn't convenient. So it made it difficult for us to have access. We didn't have a therapy pool in the athletic training room. But when I went to grad school and started working with gymnastics, those girls took such a pounding day in and day out that I ended up using pool, if not every day, at least 3 or 4 times a week. And it was just a really good tool that I could use to help them recover while also working on some of their deficiencies. So if you have access to it, then by all means, this can be a really effective adjunct to your care. All right, so some terms to be familiar with here. First of all is buoyancy. If an object is buoyant, it floats, okay? So buoyancy is the vertical upward force that unloads or deloads our patient. So the deeper they are in the water, the more offloaded they're going to be. And that's provided they've got a specific gravity of less than 1, okay? So water has a specific gravity of 1 gram per cubic centimeter, and anything that has a specific gravity greater than that will sink, and anything that has a specific gravity less than that will float. So many times our athletes who are particularly lean, they have a low % body fat, they will have a higher specific gravity. So that means that just putting them in the pool by themselves won't necessarily lead to buoyancy. It won't necessarily offload them. So we have to use some tools. So an aqua jogger or floaty boots or floaty gloves, those kinds of things. Okay. So there is the offloading principle of aquatic therapy. The other is that aquatic therapy can provide gentle resistance, and that's because water has viscosity. Okay, so the degree of friction acting on the body. So I think it was last week we talked about how the intraarticular fluid viscosity changes, and I actually said that backwards then, and thank you, Sean, for correcting me. The greater the viscosity, the greater the resistance. So water obviously has a greater viscosity than air does. So just moving body weight on dry land, really we're only working against gravity. We're not working against any other resistance, whereas in water, that doesn't necessarily hold true. Some other terms to be familiar with, we also have hydrostatic pressure, and this can be beneficial if a patient has mild swelling. Okay, the hydrostatic pressure, just being in the water, provides mild total body compression. and that goes up as the depth at which the body part goes down. Okay, so the deeper we go, the more hydrostatic pressure. So generally speaking, in aquatic therapy, we're talking neck down. So it's not a dramatic impact, but this is nice because if we've got them in a gravity dependent position, let's say they sprain their ankle, we've got them in an upright position. If they're on dry land, then gravity is going to lead to an increased swelling. Whereas if we put them in the pool, the hydrostatic pressure of the water helps offset that a little bit. So when they get out of the pool, even though they've been vertical, upright, they've been partially weight bearing, chances are pretty good that their edema is not as severe as it would be if we just had them on dry land the whole time. So that's kind of a nice little added benefit. And we can assist that by wrapping them with an ACE bandage or putting some other type of circumferential compression on them before we put them in the pool. Okay. Another term to be familiar with here is drag, and this is the resistance to movement through water. Now, some of our therapy pools will use a treadmill in the bottom and the water stays put. Other therapy pools are what are called flume pools, and there's no treadmill in the bottom, but the water actually moves through as a general current, and there's some drag there. We also know that water has an accommodating resistance due to drag. So the harder I push, if my hands are underwater and I try to punch you, I remember when I was a kid playing in the pool, you discover this pretty quickly, that you can't move quickly through the water, and the harder you push or the harder you kick, the more drag you encounter and the greater the resistance. So this is an accommodating resistance. So yesterday we talked about painful arc. This is really nice. If I'm moving through internal-external rotation and I'm using a band, it doesn't accommodate. My patient can't just do less and offset or offload that painful arc. Whereas in the water, they can pull through with as much force as they're comfortable with generating, and then in that weaker or more painful section they can let off, and the resistance is going to be less. So this accommodating resistance, we'll revisit this term when we talk isokinetics, but this can be really beneficial early on to prevent soreness or prevent pain due to resistance. And then another term here is turbulence. So in this diagram you see laminar flow, we've got nice smooth uniformity through the water, and then with turbulence we've got disruption of laminar flow. So we end up with forces going in all different directions. So some of our therapy pools will use immersion jets, almost like a hot tub jet, like the HydroWorks model actually has a therapy jet on a hose so that we can introduce turbulence. So we can basically use the water to introduce some perturbations like we talked about in dry land. So that can be a nice little adjunct to our resistance as we kind of improve and progress through the rehab process. So we know water leads to decreased loading. Lots of times we put the patient in the water and we offload what causes their pain. Their mechanics will actually clean up. We get a patient with anterior knee pain. Just being on dry land is enough to negatively impact their mechanics, and finding a way to offload them and get rid of that pain can really benefit them. Okay. This also gives us early optimal loading without collateral damage to the body part around the area. You know, if they've had a surgical incision, as long as it's closed enough that they can get in the water, then we can start to move them through some partial weight bearing, full range of motion type exercises. Lots of times aquatic therapy is used in senior centers or at YMCA because of the analgesic effect, especially if it's warm water. It just feels good to be in the pool. Okay. There's also some growing literature that tells us that being in water has psychological benefits. There's some well-being associated, and a mental sensation of well-being associated with being in the water that we don't get other places. This may help with compliance. If you've got a patient who's kind of checking out on you for dry land rehab, if they know they're going to the pool that day, then that's almost seen as a treat or as a reward. So it can be a powerful tool there. And then, as we said, there's also accommodating resistance, which in some cases can be a very, very good thing. Some precautions and some contraindications here. We know we use aquatic therapy in the medically frail quite a lot. Okay, really our only concerns here have to do with, well, there are several. So first of all, COPD, chronic obstructive pulmonary disease, that doesn't mean they can't do aquatics. So remember, these are precautions. So being in that warm, humid environment is usually good for breathing, but there may be instances where it may be too humid. It may be difficult for them to breathe. Cardiac conditions, again, we want to keep our exercise stimulus relatively low so that we don't overtax the patient. With ear conditions, we know that being in the water can increase their risk of ear infections, so we might want to use earplugs with them. Depending on the water temp, thermoregulatory issues may cause some problems. We see this in the very young and in the elderly, and if the water temperature is too far away from their body temperature, then it can cause some problems. Decreasingly so, we see plaster casts. A lot of physicians are moving more towards water resistant or waterproof, removable, moldable plastic splints instead of casts so that you can get the patient wet. If they've got an anxiety of water, not a phobia, but an anxiety, then we may want to keep them in the shallow end, make sure their feet are in contact with the floor of the pool. We don't want them in the deep well, that kind of thing. And then any precaution that they would have on the land would hold true in the water. Okay, so if we've got a precaution against knee flexion greater than 90 degrees, we uphold that in the water. The water doesn't magically lift that precaution. Contraindications, unstable vitals, these patients really aren't well suited for rehabilitation anyway. Diminished lung capacity, again, the moisture and the temperature can make breathing difficult. A phobia of water, where they have just an abject fear of being in the water, we're not going to force that. The benefits aren't worth the cost that would come at. Probably the biggest one that we deal with, frankly, is open wounds. Their post-surgical incisions need to be healed before we throw them in the water before they get in the water, because of the risk of infection. So we can use occlusive dressings. We can, kind of monitor them until they're ready. But in my experience, it's better to just start off with some very simple isometrics for the first day or two, kind of get them educated and up to speed on the rehabilitative process, and then by that time, they're ready to have their sutures removed, and then we could start in the pool shortly thereafter. Some methods and techniques. I've given you a link here. You can just go to YouTube and search for bad gauze. This is a specific aquatic therapy technique that in some ways is similar to dryland PNF. It's kind of predetermined movement patterns. They're not as multiplanar, multi-axial as PNF, but the idea here is that the patient is moving through a predetermined range. The clinician provides some perturbations in the water through the movement as the patient tries to move through full range of motion. Now, lots of times they'll either be in kind of a floaty tube or a kickboard, something like that, so that they may be supine in the water, and we're working on ankle range of motion in more of a horizontal orientation as opposed to a vertical. So you can kind of check that out. More often than not, in athletic training, when I'm using pool therapy, I'm not using this or Watsu or the Halliwick method. I am basically doing kind of a pool version of my dryland rehab. But this is one, if we're doing pool rehab or aquatic therapy exclusively, this is one method we can use. Another is what's referred to as the Halliwick method, and this is similar to some of the neurodevelopmental techniques used on land in patients that have motor delays, or they've had some sort of injury that's led to a loss of innervation and they need neuromuscular re-ed. So typically they're going to be positioned in a given stance or a given position. They're pre-positioned there, and then there's turbulent flow surrounding them. So you can almost think about this one as kind of rhythmic stability using water instead of using physician or clinician resistance. And then Watsu, on the other hand, is a progressive relaxation technique. So if we've got hypermobility in a specific muscle or group, too much muscular tension, we can use this as a technique to try to trigger relaxation, to try to get them to relax that particular muscle. We can combine this with strain, counter-strain, or acupressure. These are techniques intended to try to overload the sensory afferents with information. We provide that direct pressure. We hold that for a given period of time, and then we probably get that release. Okay. And then there's another link here you can check out for hydromassage. This is basically using the jet on the therapy pool to strip away waste product, to otherwise provide some sort of mechanical stimulus to the soft tissue. Now, as far as equipment, there's kind of two different varieties here. There's equipment that is used to help the patient stay afloat, and then there's equipment that's used to add resistance. Okay, and some of the things actually can be used for either, depending on how you use them. So aquabells are one example. So a kickboard, I don't have a picture of that here, but basically that's just a floating board. The patient can kind of lay over the end and put themselves in a prone position, and then they can scissor kick using the lower extremity. An aqua jogger is a flotation belt that just clips on, and it helps the patient be able to stay upright in the deep end of the pool so that they can do unloaded varieties of jogging, jumping jacks, I mean basically any kind of exercise, but it allows them to be able to do that unloaded in the water without the need to tread water and keep themselves afloat. Aqua runners, it's basically made out of the same material, it just slips over their feet, and this provides a little added buoyancy. So if you've got a patient who's particularly lean, they may need both or all five of these things. So here the patient's using a couple of aquabells, and that may be used to keep the upper body afloat. If you've got a patient that's a little less lean, then the aqua jogger itself may be enough. Okay, so anything that's designed to help the patient stay above water is a buoyant piece of aquatics equipment. Drag equipment, on the other hand, is designed to enhance the drag or the resistance of the water. So webbed gloves makes it more difficult to move the upper extremity through the water. We're basically just catching more water, and it's resisting that movement. So instead of doing band resisted internal and external rotation exercises, I can use the webbed gloves, and they provide more resistance. My normal swim fins, okay, the fins that you strap on your feet, can be used to add drag. These are specific pool therapy attachments that would resist, as they're configured now, AB and adduction. We can then swivel those around the other way to resist sagittal plane flexion extension. Okay, so these kind of resistance fins, if you will. So there are boots, paddles, all kinds of things that we can use. We can also use resistance equipment. So this can actually have weight to it. I mean, you can use dumbbells and barbell plates in the pool if you're so inclined. Sometimes there's rules against that. They don't want iron objects in the pool water, so you have to be careful here. Lots of places they'll have the swim noodles, they'll have the kickboards available for your use. Everything else you'll have to bring. Okay, so actual dumbbells I can use. These are flotation TheraBand, and basically this is the same material as you'll find in a foam roller, and it floats, and so holding it above the water will help me float. If I try to press it or move it around, I have to resist water's want or need to get that thing back above the water, so it can be used for resistance. I can also use TheraTube or tubing, TheraBand, various weight cuffs, but again, I want to make sure that it's something that's designed to get wet, otherwise it's not going to hold up too terribly long. So some examples of some lower extremity exercises. Now the setup we had at U of A involved a swimming pool that had a graded floor and then a diving well that was, I don't know, 15 or 20 feet deep. So depending on what I wanted to do, I would put the patient in one or the other. If I wanted strictly non-loaded anything, then we go straight into the diving well. If I wanted partial weight bearing, then we go into the actual pool. Okay. If you've got a therapy pool in your facility, lots of times the treadmill is adjustable in terms of depth, and that's important to know. So this diagram shows me what percentage of the body weight is offloaded depending on how deep the water is on the patient. So if I just put them waist deep, I've offloaded roughly 50% of their body weight. If they're neck deep, I've offloaded 90% of their body weight. So some of the things I would do here, some speed and agility. So I would work within a given pool lane, and we could work zigzag drills where I'm just going to basically run to the boundary, touch, and then cut out to the other boundary and just kind of zigzag back and forth. I can do what are called gears, where the patient's basically got 3 speeds and I call a number. So if I say first, then they're just kind of jogging. If I say second, they're going kind of mid-range, and then high gear, they're going as fast as they can. And so I can do any of these drills or options here using this concept of gears, because they're able to monitor or manage their own exertion here. Backpedaling, I can use this. This is great for hamstring and glute. So basically they're backpedaling through the water, or I can work in a lunge, especially if it's pretty shallow and you know they're waist deep. Then they're backpedaling, they're lunging as they go, and you know, getting the benefit there. I can also work in some jump drills, some hops and plyos. We can use the steps entering the pool if you have those. So lots of times, you know, I didn't have that available to me in our actual Olympic pool, but if I'm doing therapy at a hotel pool, then I definitely have stairs there. So they can do depth jumps or box jumps onto the step, and neuromuscularly it's going to be similar, but in terms of load and compressive force, I've reduced that pretty substantially. And then sport-specific movements, lots of times I'll do this with wide receivers or running backs. We'll get a ball, you know, they'll run pass routes, or they'll do specific blocking schemes. For a baseball player, I might get we had a bat handle chopped off with an eye hook on the end, and they would just kind of work on resisted hip motion involved with their swing, or a resisted ball, just to try to work kind of head to toe function while offloaded. Some deep water things. So this is all shallow water. Deep water things, aqua jogger running. We just put them in the aqua jogger and have them go. That's more for cardiovascular conditioning than anything. We can have them tread water for intervals, okay, either with no weights or with no hands or with a weight. So I may have the patient, and we may do a 20-minute interval program. I have an app on my phone that's really beneficial for that. I'll show you what that looks like if you can see it. It's called Interval Timer, and so the one I use for general conditioning is a 30-30 for 16 minutes, and this is set so that it will run 30 seconds, and then it'll notify me, and then I can basically rest for 30 seconds, and it will do that 16 total times. Okay, I can configure that any which way I want. So in the case of treading water, I might set it to 2 minutes on, 30 seconds off. So they're treading water, they're out in the deep water, not touching anything, just trying to keep their head above water, and then for 30 seconds they can grab the edge of the pool and relax. Okay, we can do this with no hands, so with their hands out of the water, so they're just flutter kicking the whole time, which is pretty taxing. Or even harder still, they've got a weight above their head. So one of my gymnasts would tread water for 4 or 5 minutes at a time with a 45-pound plate over her head. That's how strong her lower extremity was. So next time you're in a pool, give that a shot, just trying it without your hands, and you'll appreciate just how difficult that is. Some other things, barbell cross-country ski. Here we're basically having that patient scissor their legs and scissor their arms. So it says barbell, probably better labeled dumbbell, using something like these aqua bells. They're scissoring through kind of full range of motion hip, full range of motion shoulder. And then Another one here, kickboard with legs only propulsion. Basically, they just kind of rest their arms and just flutter kick their feet around that deep well of the pool. Some other things we can do here, we can actually use the water for mobility's sake, and this is a great cool down alternative. If your patient's just kind of mentally checked out, you know, they're 3 months into rehab and they've made good gains but they're frustrated, just take a mobility day in the pool, and you'll be surprised at just how often this will actually help them psychologically as much as anything. But as far as static and dynamic stretch, heel slides where we basically just have them scissor through full range of motion in shallow water to try to get as much mobility through the hip as possible. Leg swings where we're going to swing back and forth. We can have their arms on the back wall of the pool, and they're just going to swing to and fro. And then standing scorpion, we're going to spin them around and they're going to face the pool deck, and we're going to do that scorpion movement where they're trying to open up the anterior chain as opposed to the posterior chain. And then last one there, ankle pumps, where they're just moving range of motion, just trying to get good. I don't know if you heard that or not, my ankle just popped. Trying to get full range of motion through the ankle. And then just some general strengthening exercises, okay? It's just body weight variety, hip flexion extension, heel to butt or heel to floor, ABA deduction. We can do kind of standing scissor jumping jack kind of movement. Knee flexion and extension, where again their back is, or their arms are on the pool wall and they're just moving through quadriceps and hamstrings. Body weight squats, body weight lunges, and step ups are all varieties that we can use here. Okay, so here you see a kickboard. We can use that for some of our upper extremity varieties. We use that to encounter resistance, so basically like a chest press and a chest pull. We can use that kickboard for that. ABA deduction, our PNF patterns, horizontal flexion and extension, internal external rotation, basically just moving the shoulder through its full range using the buoyant or resistant tool, depending on what we have, to provide some added resistance. Okay, so if we were in class, here's what we do. We break out and we talk through this and building out an adjunctive aquatic workout. I would encourage you, as you're building out your program, every so often throw an aquatic workout in there, okay? It can look completely different from the rest of your progressions, and that's totally cool because it's designed to be something that does kind of introduce some novelty into the routine. If you want to make it a regular part of your routine, absolutely. Okay, if you're doing ACL and you want to be in the pool twice a week early on, I encourage that too. However you want to do it is okay. Just kind of have a strategy behind it. If you're using it more as a recurrent workout, then you'll need to show some progressions. You'll need to show how you're modifying it from session to session. On the other hand, if you're just throwing it in from time to time largely for psychological reasons or to keep your athlete fresh, it's probably not as important that you show those progressions. You just want a good, well-rounded workout. Okay, so let's say you got a patient, they're 1 month post-op for ACL. What could we do here? Okay, we can use it for range of motion. We can use it for motor unit recruitment. We could use it for cardiovascular conditioning. So those gears we talked about in the deep well, they can do that as early as month 1 for sure. Okay, so here's an example of what that might look like. Okay, 5 minutes self-ranging warm-up in the shallow end. They're just kind of moving around, just kind of general motion. 1 minute of hip swings where we're going to swing those legs across the front. 1 minute of knee self-range, so they're probably going to be pretty stiff in knee flexion. So just kind of go up to that resistance and straighten it back out. Walking lunge with a ball toss. We use like a racket ball or a tennis ball where they're lunging down the pool. We're on the deck and we toss that ball back and forth. Jogging with a jump stop and a ball catch. So they're just going to jog through the pool. I toss them a basketball. They go into a jump stop, toss it back. Jog, jump stop, catch, pass. Okay. Lateral glide. This is basically just a lateral shuffle, almost like a defensive position. And we can alter their hand position, either down, out, or up, depending on what we call. So they're just gliding along, down, out, up. Okay, 2 minutes of that. Deep water gears, we do 8 minutes, and we give them 1, 2, 3. That's the gear that we're giving them. So with both of these last two drills, notice there's some feedback in there. We're making them respond or react. Okay, and then we got a 5-minute cool down. So basically a half-hour long pool workout. They've had some good work. They've worked hand-eye. They've gotten to actually touch a basketball, and they're pretty happy about it. All right, well, that's it for isokinetics. So I'm going to stop the video here, export it, and obviously you've seen it because to get to this point I would have exported it, and we'll have isokinetics next. So you'll have 2 links. This will be the first, isokinetics will be the second. So I'll see you in a little bit. Take care.